Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth, the Sitting Disease Arterial Crisis. And trust me, it's juicier than your cousin's peach cobbler. Did you know that sitting for just 3 hours straight can reduce blood flow to your arteries by 50%? 50%, people. That's like trying to drink a milkshake through a coffee stirrer. Today we're exposing the silent killer called sitting disease, and I'm going to give you one simple move that could literally save your heart. Let me paint you a picture of what happens when you park your behind in that chair all day. When you sit, your blood starts pooling in your legs like a lazy river in Louisiana. But unlike that relaxing flow trip, this is anything but peaceful for your cardiovascular system. Your blood moves through your arteries with all the urgency of molasses in January. Here's where it gets scary, and I mean Stephen King scary. Your arterial walls start becoming stiff and less flexible within hours. Hours. We're not talking about years of damage here. Your arteries are basically throwing a tantrum because they're designed to work with an active body, not one that's glued to a seat. This triggers inflammation that starts damaging the inner lining of your blood vessels like sandpaper on silk. And here's the kicker that'll really get your attention. Even if you're hitting the gym every morning at 5 a.m. like a champion, prolonged sitting is still wreaking havoc on your cardiovascular system. Yep, entirely true. I can't make this stuff up. It's like brushing your teeth and then gargling with maple syrup all day. Now let's talk about this hidden epidemic that's more widespread than bad reality TV shows. The average American sits 10 to 13 hours per day between work, commuting, and lounging at home. We've become professional sitters, and unfortunately the pay is terrible. It costs us our health. Sitting disease increases your heart attack risk by 147% and stroke risk by 90%. Your metabolism slows by 90% after just 30 minutes of sitting. 90%. Your body basically goes into hibernation mode like a bear in winter, except bears wake up after a few months and we just keep sitting. This affects everyone from office workers to truck drivers to students. If you're thinking, well, at least I'm not alone in this, that's not exactly the comfort you want when we're talking about your arteries turning into rusty pipes. Let me tell you about Sarah, a 42-year-old accountant who came to see me last year. She was sitting 9 hours daily crunching numbers while her arteries were getting crunched. Despite eating cleaner than a whistle, her cholesterol spiked and her blood pressure rose faster than gas prices. When I examined her, I diagnosed early arterial stiffening from sitting disease. Sarah looked at me like I'd told her she was allergic to chocolate. But here's the beautiful part. The solution was simpler than her tax code. She set hourly stand-up reminders on her phone and saw improvements in just 6 weeks. 6 weeks. Her arterial flexibility returned to normal ranges, and she felt like she'd discovered the fountain of youth in her office chair. So why does standing every hour work like magic? When you stand up, you activate your calf muscles, which act like a second heart. I call them your backup singers. They're supporting the main act upstairs. These muscles pump blood back up to your heart and keep your arteries as flexible as a gymnast. Even 2 to 3 minutes of standing reactivates your metabolism faster than jumper cables on a dead battery. Blood flow increases immediately, reducing that dangerous clotting risk that makes cardiologists like me lose sleep at night. Here's your actionable takeaway, and this is simpler than making instant coffee. Set a timer for every 50 minutes, not 60, not 45, but 50 minutes. When it goes off, stand up and walk for 2 to 3 minutes. Walk to the water cooler, walk to the bathroom, walk in circles if you have to. Your arteries will thank you like you just gave them a spa day and you could literally add years to your life. If you're sitting there right now listening to this and haven't moved in over an hour, maybe I should see you in the clinic. We need to talk. But seriously, start today, start right now. Stand up, do a little wiggle, and make a promise to your heart that you'll break up this toxic relationship with your chair. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.